Hepatitis B is a serious and potentially life-threatening infection that targets one of the most important organs in your body, the liver. This disease can affect anyone, regardless of age, gender, or background, making it a universal health concern that everyone should be aware of. It is caused by the hepatitis B virus, or HBV, a tiny but powerful virus that can survive outside the body for at least 7 days, making it highly infectious and easy to spread if proper precautions aren't taken. Your liver acts as your body's main filter, cleaning your blood, breaking down harmful substances, and storing energy in the form of nutrients. It's essential for digesting food, fighting infections, and keeping your body balanced. When the liver is infected by HBV, it becomes inflamed and can't function properly. This inflammation can be mild and short-lived, or it can become severe and last for years, silently damaging the liver over time. The word hepatitis literally means inflammation of the liver. Hepa refers to the liver, and itis means inflammation. There are several types of hepatitis, but hepatitis B is one of the most common and dangerous forms. HBV is a global health issue, affecting millions of people in every country, often without them even knowing it. In fact, many people carry the virus for years without any symptoms, which is why it's sometimes called a silent infection. Because symptoms can be mild or absent, many people don't realize they're infected and can unknowingly spread the virus to others through blood, unprotected sex, or from mother to baby during childbirth. Over time, if hepatitis B is left untreated, it can lead to serious complications like cirrhosis, which is scarring of the liver, and even liver cancer. These conditions can be life-threatening and often require long-term medical care. Unlike some other viruses, HBV can become a lifelong chronic infection, especially if you're infected as a child. Chronic hepatitis B can silently damage the liver for decades before symptoms appear. Some people are able to clear the virus from their bodies, but others live with it for life, facing the risk of ongoing liver damage and the need for regular medical monitoring. Every year, hundreds of thousands of people around the world lose their lives to hepatitis B-related liver disease, making it one of the leading causes of liver failure and liver cancer. The good news is that there's a safe and highly effective vaccine that can prevent hepatitis B. Getting vaccinated is the best way to protect yourself and your loved ones from this serious disease. And for those who are already infected, there are treatments available that can help manage the virus, reduce the risk of complications, and improve quality of life. Vaccination can provide lifelong protection, giving you peace of mind and helping to stop the spread of hepatitis B in your community. For those already living with hepatitis B, regular checkups and following your doctor's advice can help control the virus and protect your liver from further harm. Understanding hepatitis B is the first and most important step to protecting yourself, your family, and your community from its effects. Our goal is to give you clear, practical information so you can make informed choices and take control of your health and well-being. Hepatitis B spreads through blood and certain body fluids, not through casual contact. You can't get it from hugging, sharing meals, or sneezing. The virus is present in blood, semen, and vaginal fluids. One major route is from mother to baby during childbirth. Without intervention, babies are at high risk for chronic infection. Sexual contact is another common way the virus spreads. Using condoms reduces risk. Sharing needles or drug injection equipment is extremely risky. Even tiny amounts of infected blood can transmit the virus. Non-sterile tattooing, piercing, or medical procedures can also spread HBV. Sharing personal items like razors or toothbrushes is a less common but possible risk. Healthcare workers are at risk through accidental needle sticks. The key: direct contact with infected blood or body fluids is the main danger. Knowing how HBV spreads helps you take steps to prevent infection. When HBV or hepatitis B virus enters the body, it specifically targets the liver, one of our most vital organs responsible for filtering toxins and supporting overall health. The body's immune system quickly recognizes the invader and triggers a complex immune response, sending specialized cells to fight off the infection and protect the liver from harm. This initial stage, known as the acute phase, typically lasts up to 6 months. During this time, your body works hard to eliminate the virus, and symptoms may range from mild to severe, or sometimes there may be no symptoms at all. Most healthy adults are able to clear the virus completely thanks to a strong immune response, and as a result, they develop lifelong immunity against hepatitis B. Their liver usually recovers fully with no lasting damage, and they can return to normal life without ongoing health concerns related to the infection. However, if the virus is not cleared from the body after 6 months, the infection becomes chronic, meaning the virus continues to live in the liver. Chronic infection is much more likely to develop in infants and young children whose immune systems are not yet fully mature and may not be able to fight off the virus effectively. In fact, about 90% of babies infected at birth will go on to develop chronic hepatitis B, putting them at risk for long-term liver problems. In contrast, only about 5 to 10% of healthy adults who become infected will develop chronic infection, as their immune systems are usually strong enough to clear the virus. Chronic HBV means the virus stays in the liver for years, causing ongoing inflammation that can silently damage liver cells over time, even if you feel healthy. Over many years, this persistent inflammation can lead to serious complications, such as cirrhosis, which is scarring of the liver, or even liver cancer. That's why managing chronic hepatitis B is crucial. With proper care, including medication and lifestyle changes, you can help prevent these severe complications and protect your liver's health. Regular monitoring, blood tests, and timely treatment can make a significant difference, helping to catch any problems early and keep your liver functioning well. Early detection and ongoing care are key to maintaining long-term health and living well with or after hepatitis B infection. Many people with hepatitis B have no symptoms, especially children. When symptoms do appear, they often resemble the flu fatigue, fever, muscle aches, and nausea. As the liver becomes more inflamed, jaundice can develop, yellowing of the skin and eyes. Dark urine and pale stools are other warning signs. Abdominal pain, especially in the upper right side, may occur. Most people with acute infection recover without lasting problems. 2/3 of acute cases have no noticeable symptoms, making the virus easy to spread unknowingly. Chronic infection can be silent for years, with symptoms only appearing after significant liver damage. Advanced symptoms include persistent fatigue, jaundice, swelling, and easy bruising. Regular checkups are vital for anyone at risk or living with hepatitis B. Anyone can get hepatitis B, but some groups are at higher risk. Infants born to infected mothers are especially vulnerable. Prenatal screening is essential. People who inject drugs and share needles face high risk. Healthcare workers are at risk from accidental exposure to blood. Those with multiple sexual partners or unprotected sex are also at risk. Living with someone who has chronic hepatitis B increases risk if personal items are shared. People who receive blood transfusions before 1992 may have been exposed. Travelers to regions where hepatitis B is common should take precautions. Hepatitis B is diagnosed with a simple blood test, which is usually done in a clinic or hospital setting. This test is quick and only requires a small sample of your blood, making it accessible and convenient for most people. Because symptoms are often absent or very mild, many people don't realize they're infected. That's why testing is the only reliable way to know for sure if you have hepatitis B, even if you feel perfectly healthy. The main test looks for the hepatitis B surface antigen, or HB-Sag. If this antigen is found in your blood, it means you're currently infected with the virus and can potentially spread it to others. Additional blood tests are often performed to check for antibodies. These help doctors determine if you're immune, have a past infection, or if the infection is new or ongoing. The hepatitis B surface antibody, called anti-HBs, means you're protected. This protection can come from getting vaccinated or from recovering after a previous infection. Another important marker is the core antibody, or anti-HBc. This shows if you've ever been infected with hepatitis B, even if it happened years ago and you didn't notice any symptoms. By combining these test results, doctors can tell if your infection is recent, long-term, or if you're now immune. This information is crucial for deciding what steps to take next. If the hepatitis B surface antigen stays positive for more than 6 months, it means the infection has become chronic, and you may need ongoing medical care and monitoring. These tests guide your doctor in choosing the best treatment plan for you, whether it's regular monitoring, medication, or lifestyle changes to protect your liver. Early diagnosis is key to preventing serious liver damage, such as cirrhosis or liver cancer, which can develop if hepatitis B goes untreated. If you're at risk, such as if you were born in a country where hepatitis B is common or have a family member with the infection, ask your doctor about getting tested as soon as possible. Testing is quick, accurate, and can save lives by catching hepatitis B early. Don't wait, knowing your status is the first step to protecting your health and the health of those around you. Treating hepatitis B depends on whether the infection is acute or chronic. Acute infections usually resolve on their own with rest and supportive care. For chronic hepatitis B, the goal is to control the virus and protect the liver. Not everyone with chronic infection needs immediate treatment. Doctors decide based on viral load and liver health. Antiviral medications like tenofovir and entecavir can suppress the virus and reduce liver damage. Treatment is often long-term and must be taken exactly as prescribed. Regular monitoring with blood tests and sometimes liver ultrasounds is essential. Stopping medication without medical advice can cause dangerous flare-ups. With proper management, people with chronic hepatitis B can live long, healthy lives. Early and consistent care makes a big difference. Stay in close contact with your healthcare provider for the best outcomes. The hepatitis B vaccine is the most effective way to prevent infection. It's safe, effective, and given in a series of shots over several months. The vaccine teaches your immune system to fight the virus without causing illness. All infants should get their first dose at birth, followed by additional doses in the first 6 months. Vaccination is also recommended for unvaccinated children, teens, and high-risk adults. Healthcare workers, people who inject drugs, and those with multiple sexual partners should be vaccinated. If you're unsure of your status, a blood test can check for immunity. Beyond vaccination, practice safe sex, never share needles, and avoid sharing personal items that could have blood on them. Choose reputable facilities for tattoos or piercings. Combining vaccination with these precautions can stop the spread of hepatitis B. Protect yourself and your community. Get vaccinated. Hepatitis B is no longer a story of fear. It's one of hope and control. Vaccination and modern treatments mean most people can live healthy, full lives. Regular monitoring and medication help manage chronic infection and prevent complications. Healthy habits, like a balanced diet, exercise, and avoiding alcohol, support liver health. Emotional support is important. Stigma can be overcome through education and community. Support groups and counseling can help reduce isolation and anxiety. Educate friends and family about how hepatitis B is and isn't spread. Knowledge and action are our best weapons against this virus. By understanding, preventing, and treating hepatitis B, we can protect ourselves and others. The future is one where new infections are rare and everyone gets the care they need. Together, we can replace fear with confidence, control, and hope.